This is my best friend Julie, and she's hilarious, but above and beyond making me laugh, she inspires me because she's a dedicated runner. And the level that she runs at takes some serious commitment. Right before this video, she ran a 100K race, which is 64 miles. So today, I'm working on her legs. I'll be using a lot of friction techniques in this video, so today I decided to pull out my pulp friction butter, which also smells like citrus, so everybody wins. And I'm diving right into the quads. So you're going to see a theme throughout this video, and that theme is very specifically starting with friction and then diving in with some deeper work. So each section of the legs that I'm working on, the quads, the hamstrings, the lower anterior legs, the calves, I'm going to be sticking with the same routine where I initiate the work with a lot of friction, generating a lot of heat, and then sinking in a little bit deeper down into the muscles and the deeper structures. And the reason for this is simple. Doing an extremely long run or really engaging in any physical activity where you're asking one group of muscles or one general area to do the same thing over and over again for a long period of time, you're basically asking those muscles to contract and create a force that is above and beyond the normal state of rest and movement. When those muscles are pushed beyond their limits, their ability to release is then minimized because those contractile fibers have been trained to grab on and continue to create force. If you noticed, I really worked through the quads down into the attachments around the knee and around the patella, and I've generated a lot of heat. And what that does is it starts to create a thixotropic effect so that the connective tissue that surrounds all of those muscle tissue elements starts to melt away a little bit, starts to disengage, starts to break apart so that when I go to sink down into the quads themselves, I'm able to sink down a little bit deeper. But revisiting why this is so important, when you have put the demand on your muscles like my friend Julie did with her legs in this run, the connective tissue around these muscles is going to react in a very protective manner. In other words, if you run 64 miles through the mountains, your body might be a little bit traumatized. So our job is to reverse that process, starting with the outer layer, melting it away so that you can sink down into the muscle tissue without battling that wall of concrete on the outside. My focus is still on the quads, but I'm lifting Julie's leg up and offering her a little bit of internal and external rotation to wake the hip up so that as I bring her leg out laterally just a little bit, her lower leg can fall down, which flexes the knee and lengthens the quads so that my work is a little more powerful. With her lower leg now dangling, I'm using my left leg to anchor in so that her leg is stabilized and I can do a lot of the same work that I did with her leg on the table, just repeating this now that the quads are in a lengthened position. So I can use a soft fist, a forearm, or hands, whatever you feel most comfortable with, but creating a lot of friction and allowing the connective tissue around the quads to start to melt. Once this has happened, I can start to dig in a little bit deeper and remind some of those muscle tissue fibers to start to let go. Both you and your client will really be able to feel the warmth that's generated with this work. So once you agree that everything feels nice and warmed up, you can start to sink in. So with Julie's leg in this position, I'm stabilizing her leg by using my left hand underneath her knee, and I'm using my right hand to start to separate out the quad muscles themselves. So sliding up between the vastus intermedius, the vastus medialis, and the vastus lateralis, sinking down into the rectus femoris and creating some linear space between these larger muscle groups. I'm allowing these muscles that are really contracted down to start to release apart from each other and find some space. All of this work so far has been pushing up towards the hip. So before I bring her leg back up, I'm going to offer a little traction so that the hip joint opens back up and pull the leg back up onto the table. Friction tends to benefit the most the areas of the body that have less muscle tissue and more connective tissue, and the knee is one of the best examples of where this is true. You've got a handful of really thick tendinous attachments that cross over the knee, coming from the quads, the hamstrings, the adductors, and the gastrocs coming up from the calves. And then you've also got the IT band, the ligaments that are deeper within the knee, the joint capsule itself, and all of this is connective tissue. So the knee is ripe with connective tissue and fares well with a lot of friction. So I started with an alternating technique on either side of the knee, and I've brought the knee into flexion, which shifts the position of all of these tendons and ligaments and also the patella itself, so that as I start to work on the attachments that are interwoven with the patella and attached to the lower leg, I'm accessing these structures at slightly different angles, getting that effect that is a lot more detailed and is going to create a deeper change. Speaking of different angles, this is a particularly good position to access the patellar ligament, also known as the quadricep tendon. With the knee in this flexed position, the patellar ligament is elongated, and the ability to manipulate it from here is a particularly good one. So use some cross-fiber friction, allow for some of your force to push up superiorly. This is going to release a lot of the tension and the pull from the quadriceps down onto the tibial tuberosity, which is only going to contribute towards helping those quadriceps perform better in the long run. Extending the knee back down onto the table, I can now move down to the lower leg. The lower leg, in comparison to the upper leg, has 2 bones as opposed to 1, and the muscles that attach onto those bones tend to be a lot more sinewy and ropey. So friction in the lower leg is going to be a lot more effective, and all of these attachments that cross over the knee onto the tibia and the fibula, and then all of those tissues surrounding these 2 bones going down into the ankle, into the foot, are going to receive the friction that you're applying first here really well. The lateral lower leg definitely has a lot more muscle tissue, so I'm starting there first, and I'm using my palm to generate a lot of heat with both linear and circular friction, crossing over the bone and onto the connective tissue that surrounds the tibialis anterior and the peroneals. Once you've really warmed this area up, you can start to sink in with your thumbs and get to a nice depth on that lateral tibia. The tibialis anterior comes down at an angle, and the peroneals lie flat on the fibula, and in both instances, loosening the attachments away from these bony structures underneath creates a lot of space and allows for the contractile tissue to start to breathe. So simply repeating the pattern I used on the quads, I've created a lot of friction, I've melted away a lot of that connective tissue. Well, not literally, but I've definitely created a lot of heat so that as I sink down into the muscle tissue of the tibialis anterior and the peroneals and the other deeper muscles of the anterior lower leg, I'm able to sink down deeper and start to address in more detail and with more depth the contraction that these muscles are feeling and helping them to start to let go. After finishing that work with a little extra friction at the head of the fibula and down at the ankle, I'm ready to move medially. The friction I'm using on the medial side of Julie's lower leg here looks a little bit different. So I'm using my left hand to slide up the tibialis posterior, the anterior aspect of the soleus, and some of the deeper ankle flexors. And as I do that, I'm keeping her foot moving in a circular fashion. And what this does is allows the muscles underneath my left hand to continually lengthen and relax so that as I'm sliding up, the movement underneath is creating a friction and that connective tissue is starting to release its grip so that I can sink down a little bit deeper. I know that when somebody works on my medial shin, I kind of want to punch them a little bit. It can be really tender down here, so stay in communication. As you start to sink in, use your other hand to move the ankle around, stretch the foot out, ensure that stability for your client, offer them a little bit of a distraction, and most importantly, give your client the gift of knowing that they can tell you if anything feels like it's too much. Getting to a therapeutic depth can often take multiple sessions, so be patient with the process and remember that your client is a runner. That mental persistence can really pay off. I've flipped Julie over on the table and I'm focused in on her hamstrings, and I'm repeating the steps that I've already done on her quads and her anterior lower leg, creating a lot of friction, creating a lot of heat, and then sinking deeper into the hamstrings themselves. Once I've generated enough heat in the superficial tissues, I'm starting to sink down deeper into the muscle bellies and creating a little bit of separation between the semitendinosus and the semimembranosus, which are on the medial side, and the biceps femoris, which is on the lateral side, and starting to think about that deep fascial septum that really divides those bellies all the way up towards the ischial tuberosity. So as I work from the knee to the hip, I'm releasing those contractile fibers and at the same time helping the fascia to move more fluidly. As you guys probably already know, tight hamstrings can be the root of so many dysfunctions that show up in the knee and in the hip, and even down the IT band and throughout the lower leg. Because that hip extension and knee flexion is so important in running, these muscles tend to get overused, not stretched out properly, and creating a disharmonious pull between the hip and the knee. Moving down through the knee, adding a little extra friction here can be like making sure there's enough icing between the layers of your cake. It just keeps everything in good shape. Just make sure you apply that icing, also known as friction, on the hamstring tendons themselves and stay light over the back of the knee. For my next trick, I'm going to offer a couple different demos for how to get a little bit deeper into the hamstrings, and the first one is a quick and repetitious pin and stretch. I'm using a soft fist to pin down different areas throughout the hamstrings and using my left hand to extend the knee, which lengthens the hamstrings. And the pace at which I'm doing this inhibits the muscle's desire to contract back down. So I'm shifting the way the muscle communicates with the brain. And then I'm moving on to a compression with some movement. So as I press down again into the hamstrings, I'm using that lower leg as a lever and rocking it back and forth, medial to lateral, allowing the pressure that my right hand is implementing to move around all of the elements of the different hamstring fibers. Switching to a more specific point of contact is going to give you more detail, but it's also going to feel a lot sharper to your client. But if you know any runners, you know that they like to push themselves, and oftentimes this is the kind of work they want. Just stay in communication and don't push them beyond what they need. Moving down to the last but definitely not least involved muscle group of the legs, for runners, I'm down into the calves. So what most runners do is focus with a lot of intention how their feet are striking the ground, and this comes with a lot of detailed movement of all of the muscles of the lower leg. The calves tend to take the brunt of it, and whether or not your runner is consistently running on pavement or dirt roads or mountain trails, there's a lot of work that the foot and the ankle has to do, and a lot of that work takes a toll on the lower leg. If you think about it this way, the muscles in the lateral and the medial aspects of the lower leg have the fine motor skill of stabilizing the ankle and the foot, while the muscles that are on the anterior and posterior sides have the gross motor skill of moving the ankle into plantar flexion and dorsiflexion, which is what running is all about. It's a forward motion, it's not side to side, and these bigger muscles are doing more work while the smaller muscles are doing more stabilization. This is true in general, but it really shows up with running. So I focus a lot of my friction on the lateral and medial aspects because this is where more connective tissue is, because that's true of those smaller muscles. And then once I've wrapped that around and created a lot of warmth, I can sink into the bellies of the bigger muscles that are doing most of the work and start to shift things into a more relaxed state that helps the leg as a whole. I've just done a lot of really great deep work into the gastrocs and the soleus, and I'm sliding that friction down through the peroneals all the way into the ankle. This is where I feel like this kind of work is most effective, well, here and in the knee. Friction can really create a lot of fluidity with these tendons and ligaments that are holding these structures in place. So pulling this friction down around the ankle is going to help the Achilles tendon start to relax, sliding up through the peroneals and pulling that work up into the bellies of the gastrocs and the soleus is going to trigger a letting go of all of these contractile fibers that are so commonly overused in runners. It's a little difficult to see here, but as I use my left hand to slide up the peroneals, I'm using my right thumb to sink into the insertion of these muscles in the bottom of the foot. So I'm addressing the bellies of these muscles and the attachment site all at the same time, bringing the ankle through some movement, which is going to slide the peroneals not only through their own sheaths of connective tissue, but alongside each other as well. So the completion of this work really is from the origin at the head of the fibula all the way down into the insertion at the bottom of the foot. At this point, I'm just giving a little extra love to the most accessible part of the soleus, which is the most inferior part, and then again bringing that friction down through the Achilles tendon and into the calcaneus, because that is where the gastrocs and the soleus have the most pull. Of course, I also think it's important to include a lot of detailed footwork and stretching for your running clients, and I've got a whole video on stretching for runners coming soon. Just remember that your client places a huge demand on their legs, but if you show up with the research and the know-how and the detailed work that is going to help your client to keep running, they will keep coming back to you. Thank you so much for watching, and a special thank you to all of my supporters on Patreon. There is no way I could do any of this without you. There are links below to my website. Follow me on social media. Head over to Patreon if you're interested. And as always, don't forget to be awesome.